So I think it's important to remember and to think about when patients with obesity come to see us, what have they faced? What have been their struggles? What shame and blame and bias have they faced? So one of the first things that I do when a patient comes to see me is that I invite them to share their weight journey with me. I invite them to tell me about their struggles, about what's worked and what hasn't worked, and what they would like. What are their health goals? And then as they're sharing their story, I look for the opportunity to share with them that obesity is not their fault, that it's biology that's driving their body to carry extra weight. And their body is super smart. Their body and their brain does not want them to starve. So our bodies evolved during a time where there was a food scarcity. There was the potential of famine. And so we have a complex system that was basically designed to make sure that we always held on to extra weight, always held on to specifically extra fat, because that's how we store energy. But in the current obesogenic environment, what happens is our bodies carry extra weight, or specifically extra fat. So again, I say to them, this is biology. Your body is doing exactly what it was designed to do. Your body is very smart. But now we have to figure out how to help your body want to carry less fat, because that fat is impacting your health. But this is not your fault. Having obesity is not your fault. No more than having diabetes or hypertension is anyone's fault. So now it's time for all of us to use highly effective tools that target the pathophysiology of obesity. When a patient comes to see me for weight management, comes to see me to help them treat their obesity, I listen to them and I look for clues as to what might help that specific patient. Because every patient deserves to have individualized treatment. One medicine may be right for one person, another medicine may be right for another, surgery may be right for another patient. And so I really try and listen and hear what that patient is telling me. What we as providers really need is tools, different options to be able to provide for our patients, and basically present them with different options and then guide them towards the best therapy for them. So whether it's semaglutide or tirzepatide potentially in the future, these types of medications are excellent options for our patients. They're highly effective tools with safe profiles. So a question that I often get from providers or from patients is, well, doctor, I've lost the weight now. How long should I take this medicine for? Can I stop it now? I've lost the weight. And then we have a conversation, and we actually usually have this conversation even before we start the medicine. And basically, we talk about the fact that obesity is a chronic disease. There's no cure for obesity. So because it's a chronic disease, we need to treat it like we would treat any other chronic disease. So the example that I often use is, if you have a patient who has hypertension, high blood pressure. So if you have a patient who has hypertension and you start them on an antihypertensive medication, what happens? Their blood pressure goes down. It improves. Now, if their blood pressure is improved with a specific antihypertensive, would you stop that medicine? What would happen if you stopped that antihypertensive? Well, their blood pressure would go up, and we're not surprised. So in the same way, if you have a patient who has obesity and you start that patient on an anti-obesity medication and their weight decreases, their body fat mass set point decreases, well, what would happen if you stop that medicine? They lost the weight, but you stop the medicine. Well, their weight gain comes back. They regain the weight. And so we should not be surprised that weight gain occurs when we stop the treatment. And so that really underscores the fact that treatment needs to be continued. So if a patient is started on an anti-obesity medication and they lose weight, that medication needs to be continued to maintain that weight loss. Obesity is a chronic treatable disease. We should treat obesity as we treat any other chronic disease, with effective and safe approaches that target underlying disease mechanisms. These results in the SURMOUNT-1 trial underscore that tirzepatide may be doing just that. Remarkably, 9 out of 10 individuals with obesity lost weight while taking tirzepatide. And these results are impressive. They're an important step forward in potentially expanding the effective therapeutic options for people with obesity.